all. Thanks for coming today. I'm glad they let me out the office to do this conversation with you guys because they typically keep me in the basement of our offices. You know, I'm the tech guy, so they let me out to give this presentation. I'm going to talk about a little bit of how you can extend your HIE's care paradigm in preparation for ACOs. This is a true case study from the Rochester RHIO. So let's go through our agenda today. What I'm going to do is give you the backgrounder on the Rochester RHIO, what we're doing currently in the greater Rochester area. I'll also give you a quick technical overview of our HIE solution. I'm also going to then, and this is really what the meat of the subject is what we are doing to help extend for ACOs in preparation for ACOs. And that's really the advanced interoperability through EHRs as well as PHRs, patient health records, the patient subscription model, our transitional care services, our analytics support using Elysium Discover, as well as extending our non-traditional sources using Elysium Open Access, specifically using emergency medical services reports, as well as elder care reports, as well as perinatal care reports. So I think you guys have all seen this. This is really the definition of what an ACO is. I'll just point out three things. One is quality, cost, and overall care. Those are the three main things for the ACO, and that's really what you need to concentrate on. Everyone, you've probably heard it 30 times this weekend, but everyone knows what an ACO looks like, but no one ever seen it, just like a unicorn. So I love that one, so I always throw that one. So as you prepare for ACOs, this is really what you need to concentrate on, is quality, cost, and overall care. So a quick background on the Rochester RHIO. We are one of the 11 regional health information exchanges in the great state of New York. We are basically right here in almost central New York, bordered by Syracuse and Buffalo on to the west, as well as the other HIEs in our great state. We are one of several that are funded by the DOH, the New York State Department of Health funding, to organize and promote patient-centered information exchanges. Quick background on our technology. Really, there's three levels of our services. One is the data providers. Those are all the sources of where we get our data from. The middle layer is the services that we provide, and the last layer is the users of which we support. As you notice, there's some non-traditional sources of data here. One is insurance companies typically don't give a lot of information to HIEs. We have image exchange, which typically is new to the HIE field at this point, as well as we think we're one of the first in the country to do this, but we've incorporated EMS squads, emergency medical services squads, ambulance teams, things like that, both volunteer and paid, into our health information exchange, as well as elder care services such as Meals on Wheels for providers so that they can see the information, as well as perinatal services for those folks as well. So really being able to extend our data to a non-traditional information exchange so that we can get that information so that the physician can see all across the continuity of care, not only his labs and radiology reports, but also is the patient getting taken care of on a social level? Are they getting Meals on Wheels? What else are they getting? Then in the middle here is kind of our services layer. I'll just point out our master patient index, which kind of sits right in the central of everything. And that's really how we control how referencing the patient and things like that. And then on the bottom layer is really our users. So I also mentioned that we have some non-traditional users of an HIE. One is the EMS squads. We're going to be hooking up to the EPCR, which is basically the EMS squad's electronic medical record. Of course, we're giving hospitals access and physicians access, and we're connecting to 14 third-party EMRs today, various vendors, and also getting access to the long-term care facilities, as well as access to our consumers. We want to be a consumer patient health PHR gateway for our consumers so that they can connect. And I'll talk a little bit more about PHRs in the next coming slides. So basically, like I was saying, we connect to results delivery. We do the traditional results reports delivery to our third-party EMRs, 14 today. We're also doing cross-practice referral support using a CCD and notification messages. And then we're really extending our EHR services from the HIE so that we can cover and care for patients using the medical home as well as ACO efforts. Of our patient engagement, we're doing a two-way data exchange with PHRs, both tethered and non-tethered. Right now we're working with Google and Microsoft Health Vault. We're also looking to allow, there it is. We're also looking to allow patient health monitoring devices to connect up to the HIE so that physicians are seeing, the blood glucose monitors as well as weight monitors, weight scale monitors that are connecting via Bluetooth or whether it be to the internet up to the health information exchange. So now the physician can see all of the measurements and the blood sugars that the patient's taking at home, as well as engaging in patient care. care engine so that we can inform the health information exchange on when the patient misses appointments and things like that. So we're connecting right to the PM systems at the physician practices so that we're communicating that information back to the HIE. So now that all physicians can be in the same loop. Oh, why did you miss your PCP appointment? Well, you didn't make it to that nephrologist the other day. What happened there? So that's one of our goals, to really extend our services. Also, so one unique service we're looking at, because since the patient, when they leave the ACO, you need to know that, oh geez, well that patient left the ACO, they had an MRI at another care facility, yet you're still responsible for that patient. So we've come up with patient subscription services. So what that basically means is that a provider will subscribe to a patient. And which is an interesting concept, because right now usually you're pulling the data, but when you're subscribing to that patient, you're basically getting all the data of our community going directly into your EMR for that patient. So we're looking at that especially for admissions and discharges. How do you know your patient got admitted to a hospital? How do you know they got discharged from a hospital? How do you know they didn't get picked up by an ambulance or treated and released by an ambulance service? We found that 25% of patients that get treated by an ambulance service are actually treated and released. So say a diabetic goes into a diabetic coma, the ambulance treats them on site, and then no one knows anything. So how does that primary care physician ever know the ambulance was even at the house? And as well as vital signs and getting those information, having the physician or provider subscribe to the vital signs. As well as we're looking at a multi-stakeholder, community-based transition of care tool, so that when a patient leaves a hospital or a long-term care setting, how do you have information cross between those various stakeholders? Right now, it's a stack of papers this tall that you put into a fax machine, and it gets faxed to all the different care settings, and that's kind of not ideal, especially in this electronic world. As well as we're improving our analytic support and reporting capability so that we can, in support of all the accountable care efforts. And with that, we're using the ListCM Discover tool, which is really going to be our aggregator of reports and patient information throughout the community. So using ListCM Open Access, we were able to bring in non-traditional sources such as EMS services. We're really using web services to connect to those EPCR vendors, which is the Emergency Medical Squad's EMR system, for lack of a better term. And and there's a standard out there called NEMSIS, and that's what the EMS squad's data standard really is. And we were able to use web services, convert those into something that we viewable for the HIE, and then push it into the health information exchange. As well as connecting other services. One vendor we've connected to is called PeerPlace, which is throughout our 9-county area. And basically we're able to get services like adult daycare, yes, case management, yes, escort, no, things like that, so that the physician sees information across the care settings. And if I'm going too fast, any questions so far? Okay. You guys are a quiet crowd. And basically, this is coming to the end of my slide, this is our marketing campaign. We're really showing that the care information follows the patient no matter where they're going, whether it's an infant running across or someone a little bit older or someone a little bit later in life. This has been our marketing slogan so far. And with that, are there any questions? Oh wow, you're a quiet crowd. Very quiet. Well, when you get a little older, you tend not to run. You sometimes walk a little faster. How's that? So with that, I guess I'll conclude, unless there are any other questions in the crowd. Well, thank you. You've been a great audience.
I think I got everybody scanned, but if I did, let me scan your badge. That'll make you eligible for our digital